Hello, ladies and gentlemen. Welcome to Health Life 360. I am Dr. NIK NIKAM, a cardiologist, along with Sudhir Mathuria, who is the CEO of HealthLife360.com, located in Houston, Texas. We serve all kinds of Medicare insurance solutions, life insurance, long-term care, and many other programs. The focus on this presentation is disadvantages or limitations of a Medicare Advantage plan. Not every plan is good for everybody. There are certain people who are most benefited from a Medicare Advantage plan, and there are certain people who are better off going off with a Medicare supplemental program with a standalone prescription plan. We're going to look at some of the limitations of the Medicare Advantage plan. We are going to look at some of the limitations of the Medicare Advantage plans which you should be aware of, especially if you're in a high income bracket and you can afford the Medicare supplemental plan or the Medicare or Medigap as it is called. So let us look deeper into what are some of those limitations. As you know, we have two separate routes of Medicare insurance coverage. The traditional Medicare, which is on the left-hand side, showing Part A, Part B, Part D prescription plan, and of course the supplemental insurance, the Medigap or the Medicare supplemental insurance. Whereas on the other hand, the Medicare Advantage plan sort of combines all these three or four components and provide all the services under one heading called Medicare Plan C. It also includes your prescription plan in most cases. So what are some of the limitations of a Medicare Advantage plan? Just like any other managed care health insurance, we are going to have some limitations, and let us focus on what those limitations are and if they are of major concern to you as a consumer and you would rather go with the traditional Medicare program with Medicare Part A, Part B, a standalone prescription plan, and a Medigap plan. So let's look at some of the before we go into the disadvantages of a Medicare Advantage plan, I want to emphasize the fact that you still need to continue your Medicare Part A and Part B programs. It doesn't matter whether you're on traditional Medicare or a Medicare Advantage plan, you still need to continue your Medicare Part B premium so that either one of these programs will be effective. If you stop paying for your Part B, then you neither have Medicare Advantage plan nor a Medicare supplemental program. Of course, the premium keeps going up. Now let's look at some of the limitations of a Medicare Advantage plan. Medicare Advantage plan has two main categories, namely the HMO, which you're all familiar with your private insurance during work time, and a PPO, which has little more flexibility but still has some restrictions. The first thing is premiums. Premiums are limited to zero, whereas an HMO plan may cost you nothing to sign on. So that's one of the advantages of the top. A PPO may cost you $10 to almost $100. However, with an HMO, you have a gatekeeper, the primary doctor. The primary doctor has to approve all your referrals to the specialist or for a CAT scan or an X-ray, and sometimes there could be a time delay which can be crucial, which may force you to go to the emergency room and end up spending more money than you would have normally if you had gone through the normal route of referral. But since primary doctors deal with thousands of patients, there is going to be a time involved in trying to get those referrals. And sometimes they can be annoying, especially if you're having symptoms and you need to be seen right away. If you're in an HMO program, you have to be referred to a specialist. And when you go and see a specialist, it is not a zero service like when you're seeing a primary doctor, you have to have a co-payment for the specialist visit. So all these things need to be taken into consideration. And when you're seeing a specialist in a network, you may have a separate set of fees, but when you go out of the network, the fees can be substantially higher. And it is all spelled out in their manual, and that's something you really need because it may come to you as a surprise when you visit a specialist and you have to cough up $50 to $60 per visit. Next, you're going to need authorization for all kinds of tests. If you need like a nuclear stress test, or if you need a special procedure, you need authorization. Whereas with a traditional Medicare, you don't need authorization to do an echocardiogram or a stress test. You do have a prescription plan with the Medicare Advantage plan and also with the traditional Medicare standalone program prescription plan. But let me remind you that these prescription plans have annual deductibles, annual copays. Sometimes the drugs may be dropped and your drugs may not be on the list. So these are some of the things you need to take into consideration. Yes, you are paying less amount, but you are getting less amount of service. And sometimes the drugs may not be on your program at all when you start off. That's something you have to keep in mind. Even though the HMOs say they are zero premium, let me remind you all these co-pays, deductibles, and hospital initial deductible, ambulance deductible, all these things add up. And your out-of-pocket cost could be like $3,400 max with an HMO plan. But if you go to a PPO plan, that could be twice as much as you would pay with an HMO plan. But remember, when you go out of network, for example, you are out of town, you are in a different location, and you don't have access to your own network of doctors and hospitals. As a result, when you see doctors out of network, they are not obligated to go with the network prices. So the network cost maximum could be up to $7,000 with a Medicare Advantage plan HMO and up to $11,000 with a Medicare Advantage PPO plan. Now let's talk about doctors. When you are in a program with a Medicare Advantage plan, some of them may have a large number of primary doctors and a slew of specialists. But not all Advantage plans have that luxury. Some of the smaller ones may not have all the specialists on the list, and that will force you to go out of network. As a result, you end up spending more money when you have to see doctors out of network because they just don't have those doctors. Also remember that when you're dealing with a Medicare Advantage plan, not every Advantage plan has all the hospitals available in your area. For example, I am in the Harris County and Fort Bend County area. We have the St. Luke's Hospital System, we have the Memorial Hermann Hospital System, we have the Methodist Hospital System and HCA Hospital System. So we have 4 or 5 major hospital systems, but not all of these Advantage plans are on every hospital. But if you are on a Medicare supplemental program or Medicare Advantage, Medigap plan, they go with every hospital in the city and of course across the country. So there are some differences. Not only the hospitals are not on, sometimes the hospitals are on and sometimes the hospitals may drop the program and you may not even know that until you use their services because it changes from year to year. And I talked about the hospital copays. Same thing applies to doctors. It is very hard to find out if your doctor is on the program. Even if you go to their website and you search for their name, they may be on the program, but they might not have renewed their membership. So actually, in reality, they may not be on the program. Or they may be on the program, but it is not showing up on the website because their computer programs have not been updated. The databases have not been updated. So there are a lot of technical limitations which may make it very difficult to understand whether these doctors are on the program or not. I'm talking about especially the specialists. because when you select a Medicare Advantage plan, you want to make sure all your specialists are on the list. I was just doing a survey on a patient who was on like 13 medicines and 6 doctors. Only 3 of the doctors were on the list, and 3 of them he had misspelled the names. So we had to go and do all kinds of search, and still they were not on the program. So if 3 out of 6 doctors are not on the program, you can put that person in the Medicare Advantage plan. Then eventually we ended up suggesting this person who could afford a Medicare supplemental plan to go ahead with a Medicare supplemental plan, so that he doesn't have to worry about authorization, doesn't have to worry about referrals, doesn't have to worry about in-network or out-of-network, so he can have a peace of mind. He can go with the traditional Medicare Part A, Part B, and a standalone prescription plan, and a Medicare supplemental program, or a Medicare Medigap program. So this is a very quick overview of the disadvantages of a Medicare Advantage plan. They both have an important role to play in taking care of Medicare patients all across the nation. So don't get me wrong that because I am identifying the disadvantages of Medicare Advantage plans, that they are bad. They are not bad. It all depends upon what are the drugs you are on, who are the doctors you are seeing, what are the hospital services that you use, and what are your financial resources. When we put all these things together, certain Medicare Advantage plans are exceedingly useful for a given population, whereas the high income earners who can afford to pay for a standalone prescription plan, who can pay for a Medigap plan, the Medigap plan and the traditional Medicare route may be the right approach. So it is an individual evaluation and assessment. That's where we as agents come in. Look at your existing insurance, look at your existing medications, see what drugs are covered, what doctors are covered, what hospitals are covered, what is your income resource, and how much freedom you like to enjoy. When we put all these things together, we come up with a composite plan as what is the best approach for you in your particular case. And that may be totally different in another person who is a truck driver, who is out of work, who has no insurance, no resources, and he may need a different plan. I hope this has been useful to you, and please do contact us. We are here to navigate you through all these complexities of Medicare, Medicare Advantage, Medigap, prescription plans, and see what works best for you. Also remember that the Medicare Advantage plans are known for appearing and disappearing. That is, you may have a plan this year and it may be gone tomorrow, so you have no idea. So you have to review your Medicare Advantage plans on an annual basis to make sure that everything that you need is covered for the following year. I hope this has been useful to you. I am Dr. NIK NIKAM for Health Life 360. We are located in Houston, Texas. There's our contact information, and please do give us a call and let us help you get the right program for you for the coming years. And we have several videos on Medicare Part A, Medicare Part B, Medicare Part D, Medigap plans, Medicare Advantage plans, and a whole host of other videos including Medicare Update 2022. Please do watch them and subscribe to our channel, and I will see you in the next video.